Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Philadelphia, Pennsylvania, and on the main lines in Narberth, Pennsylvania. And today I want to talk to some of you who might be diagnosed with Piriformis syndrome, or perhaps you weren't diagnosed, but you start using Dr. Google and you come across something that seems like it might be Piriformis syndrome and what you might be dealing with. So today I'm here to clear up and give you a big picture of what piriformis syndrome is, what it typically can feel like, and what treatment from a holistic basis can help. And perhaps some of you may have already had treatment and it may have improved some of your symptoms, or maybe some of you had treatment and it hasn't improved much at all. So I'm here to show you what else might be able to help. So first of all, we want to talk about what is piriformis syndrome. So piriformis is a muscle that basically connects your pelvis to your hip, okay? And it's a deeper muscle located basically what feels like in the gluteal area. And the piriformis is what's called a stabilizer of your pelvis and your hip. So meaning when your pelvis and your hip need to have control, the piriformis kicks in and it does part of that job along with a symphony of other muscles. So let's take a look at the piriformis. So basically this is a picture of the pelvis and the spine and all the musculature, including the gluteals, okay, that are basically on this picture. So if you take this big gluteus maximus muscle away, so what most people think of as your buttocks, okay, if you peel that away, then you have these other layer of muscles which basically rotate the hip. And one of those muscles is called the piriformis, which is right here. And you can see that that piriformis connects the pelvis, okay, this muscle here is called the sacrum, to your hip right over here, okay? Now, underneath that muscle is this yellow, basically this yellow tube line looking thing, which is your sciatic nerve, which some of you guys already know what your sciatic nerve is, but it's basically a nerve that comes out of your spine and it pierces down through the piriformis. Now there's other muscles, there's other nerves, that are also in this area that branch out from other nerves called your cluneal nerves, and those nerves can get involved. So basically with piriformis syndrome, usually it happens on one side. It's typically unilateral, but some people can have it on both sides, or they start with it on one side and then it can move to the other side. It can be anything from like an achiness, a spasming in the gluteal area or the buttock area. It can cause everything from an aching, gnawing, spasmy sensation to a burning, potentially pain in the back of the leg, achiness in the back of the leg. It can cause, again, burning, numbness, tingling. That sometimes can go down in the leg, especially because that usually means that some type of these sciatic nerves or cluneal nerves might be involved. And typically it can come on from, in our clinic, we see a lot of complex patients. So we've seen everything from, turning in bed can set this off, but most of the time you'll see it with walking, going up and down the stairs, lifting your leg out to the side, rotating that hip, turning on that hip, anything from sporting injuries to just walking long periods of time to even sitting. So yes, sitting, sitting at dinner, sitting at a movie theater, all of those things can kind of set this off. So there can be a lot of different things that do that. And it just doesn't happen in people who play sports. This can happen, everything from people who are pregnant to postpartum, to people who have had sporting injuries, to people who are sedentary, to people who sit at work all day. So it can happen, it can happen to young children, it can happen to older adults. We've kind of seen it clear across the lifespan that many people can have this issue. So what do we do about it? So maybe some of you guys have already gone and perhaps you've seen a massage therapist and they worked on a lot of these muscles and it might have improved a little bit, but it hasn't improved a lot. Maybe you saw a chiropractor to improve a lot of alignment issues and they did some manipulation and that may have helped, but it hasn't necessarily taken everything away. Some of you guys might have had something called modalities, which is like electrical stimulation where they stick pads on and they put heat and ice, and maybe even something called ultrasound And again, that hasn't changed anything. And maybe some of you went to a physical therapist that did a combination of things, including those modalities, but they did strengthening and stretching and even something called Graston, which is a type of myofascial release. And maybe that helped for a little bit, but it hasn't taken everything away. So usually what we find is the big picture has not been worked on. And what do I mean by the big picture? So if you take a look at this pelvis, now we're looking at it from the back, so everything kind of looks flat. But we are not flat. We are 3D, right? So we have to take a look at the pelvis as a whole. So we're now looking at the pelvis from the top. So again, if you cut the body in half and you're looking inside the pelvis, the previous picture we were just looking at the back, okay? Now we're looking down and looking inside the pelvis. You can see that this is one big ring formed of many different joints. So here's the pubic bone, which is a joint. This is called your sacroiliac joint, which is a joint. Here is the spine, which also forms a joint onto this bone called the sacrum, okay? And all these joints move. That's why they're called joints. Some people move more than others. Some people don't move as much as others. And so that can sometimes cause certain bones to move more, certain bones to move less. And depending on if you've had an injury, if you layer on other things like a sporting injury a long time ago, which you may have like overcome, and it can be anything from like a fall onto your tailbone, it can be a hamstring injury, sometimes it can even be an ankle sprain, okay? If you layer those on to other things like sedentary lifestyle, maybe you're sitting all day, to pregnancy for women, to certain types of surgeries, you layer on back issues, okay? Your body is going to adapt and what's called compensate with whatever muscles it can so that you can continue to function, because life's main purpose is to keep you moving. And your body's gonna move whichever way it can, and it's gonna compensate and use whatever muscles it can, but at a price. Sooner or later, what's gonna end up happening is certain muscles are gonna end up compensating. I'm gonna explain to you in a minute what all that means. So basically, if this is a ring, okay, you have muscle, okay, so you have these joints, and then you have muscles that layer on top of this. So now, if we take a look at this picture, okay, this is a picture actually by Diane Lee in her pelvic girdle edition of the 5th edition of her book, okay? She's amazing Canadian physical therapist. Basically, if you look at this, okay, there's a lot of muscles here that attach onto the pelvis, okay? So here's the back muscles that attach onto the pelvis. Here's the pelvic floor, which is a muscle inside the pelvis, okay, which I showed you in a previous picture. This is the pelvic floor, which attaches into the pelvis. And then you've got these abdominal muscles, okay? And again, this is a very simplistic picture. They attach from the pelvis all the way up to the rib cage. And then you have this muscle in here, which is your breath muscle, which is called the diaphragm, which attaches onto the spine and onto the pelvis. So all of these muscles act in synchrony to each other, okay? With all the other muscles that attach. Again, this is a picture from the front of the pelvis showing you all the other muscles that attach all the way up onto the spine and the diaphragm, all the way down on the inside of the pelvis, okay, to all the other leg muscles from the front and to the side. And those muscles are what help you move. So if you go back to this original picture, which I showed you in the beginning, okay, if all of those muscles are not working in harmony and in synchronicity with each other, then the piriformis is going to kick in to help control the hip and the spine and the pelvis. And after a while, it's going to basically say, I'm tired, I don't want to do this anymore, and it can spasm. You can develop what's called trigger points in that muscle, which is basically a knotted spasming, within a muscle that doesn't allow good blood flow, which then will become painful and give you pain not only in the buttock, but it can give you pain down into the leg. And then when those muscles are tight enough, it can press on different nerves. Okay, this is just one nerve called the sciatic nerve, but there's other nerves, okay, that it can press on, and it can give you pain and tingling down into the back of the leg, okay? And then this is where, anytime that muscle is used, again, walking, sitting, doing a sporting event, it can end up kicking in and spasming. And just stretching, massaging, and, strengthening that muscle doesn't necessarily work. Just like I showed you, that whole ring, that whole pelvis, and all the muscles that attach to it might have to be worked on, because it's not only the piriformis that works, that works alone. It's all the muscles that work together. So not only will the piriformis create pain, but you can have all the other muscles that are not necessarily painful, but they might be tight or they might be weak, and this creates an imbalance. And unless you get all those other muscles balanced, meaning the tight muscles make them untight, you get the weak muscles, you strengthen them in conjunction with all the other hands-on work that you need to get done in a very particular sequential manner, that can then take the stress and the workload off of the piriformis, which then allows the pain to subside and it allows you to start functioning better. So I hope that clears up for many of you why perhaps you may have gotten treatment and it hasn't worked, and what other things might work. So for all of you that live in and around Philadelphia and the Philadelphia suburbs, or maybe within an hour or two, if you haven't had relief with any of the treatments that you've had, then you can give us a call, send us an email, and if you are interested in having an evaluation and treatment, then we are more than happy to talk to you. So come to our website. It's rebalancept.com. We have lots of other YouTube videos that might be helpful in conjunction with this, because for many people, piriformis syndrome might just be one thing that they're dealing with. There might be lots of other things that are layered on top, back pain, pelvic floor issues, other issues that are in conjunction with piriformis. Sometimes it's not a single diagnosis. There's many other things that might be going on, and we can definitely help you with that, because this is what we specialize in: holistic hands-on care for basically orthopedic conditions, but especially around the pelvic, hip, and spine. So I hope this video has been helpful to any of you. If it is, give us a thumbs up and come visit us on our website. I hope you guys have a wonderful day. Take care.